team at Ashford and St Peter's Hospitals, and I'm going to talk to you today a little bit about joint protection and how that might help you if you have something like arthritis or other non-specific pains in your hands and wrists. To begin with, the normal joint is made up of two ends of the bone and cartilage that lines it. That's surrounded by ligaments that stabilise it, muscles that move it, and fluid within the joint. When you have osteoarthritis or a wear and tear type arthritis, you have a depletion of the fluid within the joint and the cartilage starts to break down. That causes bone rubbing on bone, which is naturally a painful process and triggers an inflammatory response. When you have a rheumatoid type arthritis or an inflammatory arthritis, your body's own immune system is attacking that joint and creating inflammation. And that inflammation, as a result, can cause damage within the joint itself. All of these changes cause internal stresses, and these internal stresses you don't have a whole lot of control over. But everything you do within your daily life, your activities and how you use your hands, you do have control over. And that's where joint protection can come in. Hand therapy can help guide you with appropriate splints and supports. These can be ones that are purchased off the shelf and we provide you, or ones that we make you which are a little bit more bespoke to your needs. We can also guide you on how to address edema and inflammation that's occurring because of the changes within your joints, and appropriate exercises to complete. When these changes are happening within a joint, it can cause damage to the soft tissues that move it. So we can identify those changes and potential deformities that might be occurring. For example, you might find that this joint here starts to go back a little bit too far, and as a result, the end joint might droop down. This is called a Swan neck deformity. We also have the opposite of that can occur, which is called a boutonniere deformity, where we become a bit flexed on this middle joint and hyperextend on the end joint. Identifying these changes early on means that we can fit you with appropriate splits to prevent them from worsening and further maintain your hand function. When swelling is occurring or inflammation around your joints, that can obviously be quite painful, and further swelling within the joints can cause further damage. So we can advise you on how to address this. Things like ibuprofen, anti-inflammatory gels, appropriate use of icing, but also heat in cases of discomfort, and compression gloves can all contribute towards this. It's also important to think about how you're expending your energy conservation. When you have a lot of pain to your joints and you're not managing how you're completing your tasks, this pain can be quite fatiguing. So we want to try to plan our days, how we're doing our activities, and making sure we have rest time factored in there. We can talk to you further about this and guide you on appropriate ways to address it. So joint protection itself is looking at ways to avoid positions that might exaggerate deformities in your fingers, looking at ways to avoid tight, static, prolonged grips, and also avoiding strain on individual joints. So we might avoid tight, static grips by looking at adaptive pieces of equipment. One example of this might be if you're struggling to open a jar. We can look at small lathes that will help open that jar for you, or help you grip that so you're not having to struggle with it. We can look at increasing the surface area of how you're using your hands or the object that you're using, which will take the strain off individual joints. And also thinking about the technique that you're completing something. So for example, again, opening a jar sends all our fingers towards our little finger. This is a position of weakness. So how can we change that activity so that we're not encouraging that position of weakness and a potential deformity to occur? These are all things that are really important to consider, and small changes that you can make throughout your daily activities and make them habitual and suit you. Exercises are also important. We want to keep tendons moving and gliding, maintain range within joints, and where possible, without irritating pain, maintain strength. And we can further guide you on that as well. Thank you for listening, and I hope you find your hand therapy equipment helpful.